Amatoxins represent one of nature's most perfectly deadly compounds, and they account for over 90% of mushroom-related deaths worldwide. To understand why these molecules are so lethal, we need to look at exactly what they do inside your body at the cellular level. Amatoxins are cyclic octopeptides, 8 amino acids arranged in a ring structure. This molecular architecture gives them extraordinary stability and allows them to bind with devastating specificity to RNA polymerase II, an enzyme your cells absolutely require to function. RNA polymerase II transcribes DNA into messenger RNA, which is then translated into proteins. Every cellular process depends on protein synthesis. When amatoxins shut down RNA polymerase II, they shut down life itself at the most fundamental level. Here's the nightmare. There is no antidote. No drug exists that can unbind amatoxins from RNA polymerase II once they've attached. Medical treatment is entirely supportive care, keeping the patient alive while their body tries to clear the toxin and hoping enough liver cells survive to maintain function. In severe cases, emergency liver transplantation becomes the only option. The lethal dose is terrifyingly small, 0.1 milligrams per kilogram of body weight, which means a single death cap mushroom, one mushroom, contains enough amatoxin to kill an adult human. Children require even less. And the toxin is incredibly stable. Cooking doesn't destroy it. Drying doesn't neutralize it. Freezing has no effect. Traditional preparation methods that work for other food toxins are completely useless against amatoxins. Medical treatment protocols have evolved, but they're working against enormous odds. Aggressive fluid replacement addresses the severe dehydration from vomiting and diarrhea. N-acetylcysteine and silibinin, milk thistle extract, are used as hepatoprotective agents, though their effectiveness is debated. Early dialysis can help remove some toxin from circulation, but by the time patients typically present, much of the cellular damage is already done. Liver transplant criteria become relevant quickly in severe poisonings. Doctors watch for fulminant hepatic failure, coagulopathy where blood won't clot properly, and encephalopathy where liver failure affects brain function. The race is against time. Can they get a compatible liver before the patient's remaining liver function fails completely? Survivor testimonies are haunting. They describe the initial symptoms as feeling like a bad stomach bug, nothing to panic about. Then the false recovery where they genuinely felt better, thought they were past the worst. Then the catastrophic decline, jaundice turning their skin yellow, confusion from toxins building up in their blood, bleeding that won't stop because their liver can't produce clotting factors. Those who survive with their original liver describe months of recovery, permanent liver damage, ongoing health complications. Those who receive transplants face a different future: lifetime immunosuppression, increased cancer risk, reduced life expectancy, and the psychological weight of knowing someone died to give them that organ. The devastating irreversibility is what makes amatoxin poisoning uniquely terrifying in toxicology. Most poisons, if you survive the acute phase, your body recovers. Amatoxins create permanent damage. They kill cells that won't regenerate sufficiently. The liver is remarkably resilient and can regenerate, but if enough is destroyed, regeneration can't keep pace with failure. This is why prevention is the only reasonable strategy. Once amatoxins enter your system, you're at the mercy of how much you ingested, how quickly you got treatment, and whether your body can survive long enough for medical intervention to work.